Sean anxiously waits outside, but every entrance is blocked. Guards stand at the main doors and even at the revolving entrance. Despite trying everything, Sean can't get inside. Meanwhile, during surgery, Neil notices the patient's heart rhythm starting to change, one of the most dangerous signs during an operation. Neil asks Claire why she brought up checking the heart earlier. Claire explains that it was requested by the young man outside, the one who created the one-way valve. Neil can't comprehend how Sean predicted this and even wonders if the young man might be more skilled than himself. He orders his team to perform a cardiac ultrasound and steps outside to find Sean. Neil asks Sean why he insisted on checking the heart. Sean explains that the unstable rhythm is caused by fluid accumulating inside the heart. Just then, the operating room calls with the ultrasound results. Everything appears normal, with no fluid detected. Displeased, Neil tells Sean he was wrong and wasted valuable time, then returns to the operating room. Claire, however, senses that Sean is anything but ordinary and invites him into the operating room. Sean stares at the ultrasound images, reviewing them over and over again. While everyone else sees nothing wrong, Sean insists that the image is abnormal. The right side of the heart is slightly bulging and deformed, something extremely difficult to detect. Still, the other doctors reject Sean's proposed cardiac treatment. Claire steps in, explaining that a shard of glass may have traveled through the bloodstream into the coronary artery, carefully laying out the reasoning. Eventually, Neil agrees to operate based on Sean's diagnosis. 30 minutes later, when Neil opens the patient's chest, he indeed finds a shard of glass lodged in the heart. Had that fragment remained in the heart, the boy's life would have been in grave danger.